Good afternoon and namaste. Welcome to Sai interview. Today we are here for a Sai interview where we have Dr. Abba, who is a Rotarian and very good speaker and very insightful lady. So today our topic would be Rotary Initiative for Mental Health Awareness. And again, I really take this opportunity to introduce ma'am. So basically, we will use two languages today. We'll try to use Hindi and English together. Then the interview will be for 30 to 45 minutes. And we have the last 10 minutes for questions by the participants. Thank you all for joining us. And later, I know thousands of people will be watching this video live on YouTube. So let me take 1 minute to couple of minutes to introduce Dr. Abaji. So Dr. Abba, she is a dentist, she is an entrepreneur, life skill trainer, and she is owner and founder of Innovations Endo, which deals with education research in the field of dentistry and also sale of few dental products. And she is the owner and founder of Subho Spice. Yes. And I'm very fond of it, ma'am. She is the founder, president of the great initiative of Rotary for the mental health. Then she's, in charge for the 30-30 district, if I'm right. Ma'am, please educate me if I'm going wrong anywhere, because this is a little new for me. So this is an initiative for promoting mental health awareness. And she's also co-editor for Mind Matters. We'll understand what it is little later. It's an e-magazine. It's a signature project of this initiative 30-30. So what ma'am is doing, what Dr. Abba is doing is, she is trying to share the vision among all the Rotarians and non-Rotarians who believe in promoting mental health and also wellness in the society. She is working in a state particularly, but still she is, her exposure is across the globe. So they want to promote or they want to, inform people about the, illness which is treatable and preventable. Okay, so as Manojagriti, we are into the field since almost 15 years with a vision and mission to promote mental health. So today it's nice that, both with the same vision, same mission sitting in one place. Thank you so much, ma'am, for accepting the invitation to be a guest speaker for Sai interviews. I just want to start with a very humble and simple question for a layperson to understand what is Rotary, what actually Rotary Club means.
Okay. First
Little
of all,
confusion for society.
thank
Yeah.
you for having me here on the live Sai interview by Manu Jagriti. Now, coming to the question, a Rotary Club, in simple terms, it is a group of people, or we can call it a community, which works towards upliftment of the society. So they plan various projects, that will help the people in and around the society. That is what basically Rotary clubs works for. Basically, it comes under the Rotary International or the Rotary Foundation. And apart from Rotary, there are a few more entities like Rotaract Club, Interact Club. Then there is RCC, a Rotary Community Corps, and of course RAGMI or RAGS, that is the global groups, Rotary Action Groups. So these are the ways with which Rotary works for the people. So basically, Rotary Club is a small group of like-minded people. They are known as Rotarians. So they come together and they do various projects to uplift the people.
Right, ma'am. So I happened to attend a few meetings of Rotary Club in Hyderabad of a chapter. So where I saw all lot of positive energy around the room, and a lot of all the like-minded people talking about good things, serving the society, how I can do, what I can do. It's like the environment was filled with a lot of service-oriented minds. It was so nice. I attended 2 meetings and I felt so good because of my constraints and my limitations in my organization. I'm not able to become a Rotarian, but definitely I am, with you people to serve the society and giving back to the society. It was nice, ma'am. And so, as today's we thought of focusing more on these action groups. So let us understand what is this action group, ma'am.
There is a subtle difference between a Rotary club and or any community of Rotary and the Rotary Action Group. The basic difference is in other entities, the projects may vary. Someone might do a project related to medical, someone might do a project related to non-medical, like distributing books in a school or distributed blankets to the needy. But when it comes to the Rotary Action Group, they work for a single cause. And usually there are experts who are involved in the action group and they work in that particular field. So there are almost 25 different action groups across the globe. Say, for example, peace, water sanitization, malaria, and of course, the very important mental health. It is known as RAGMI, that is Rotary Action Group on Mental Health Initiatives. So we work across the globe and we work for mental health awareness.
Right. So which is called RAGMI.
RAGMI.
RAGMI. RAGMHI. Very good. It's like specifically for mental health awareness, what I understand.
Yes. Yes.
It's so nice because as we understand, when we focus on something, it will grow. So when you have a special focus on one issue, your energy levels will be more or your quality of work will be doubled actually. It's nice to listen because we are in the field from Manojagati since years together, working towards mental health awareness. And when I heard about this, this year there is a focus group, there is an action group for mental health. I was like, wow, that's a nice person whom I can interview.
So basically, RAGMI is working since 2015, 2016. But in the current year, we are into limelight because the Rotary International President, Gordon McInally, has given a special emphasis on mental health. And his office and the RAGMI team, we have worked hand in hand throughout the year for mental health awareness.
Wow. So the boss, the leader has took the initiative to focus on it. So wanted to understand the different projects of RAGMI. Like what are the different projects?
Okay. So there are certain projects which are, done across the globe. And then there are certain projects which are done at a local level. Okay. So majorly, if we have to talk about the global projects, we mostly work on the toolkits. Okay, so there are various toolkits, and then different regions work on those toolkits. So there is one important toolkit by the name Looking Inward, which has been introduced by our RI President Gordon. Then there is Don't Bottle It Up toolkit, where we converse using the photography. Where we talk about not holding our thoughts, not restricting. We want people to express what they are feeling, and that is why we are calling it don't bottle it up, because if you bottle it up, then we are going to have more problems. Then there are a few others like a lever, then there is wellness in a box, then there is PIP, that is problem ideas plans. This works on creative thinking, and there are few more projects.
Oh, very good. Ma'am, that names or the titles which you gave, they are like very interesting to listener. Feel like understanding everything about it or, try to educate about each thing. So can we have a detailed maybe insight or overview about this toolkit, which you said looking inward. Can we have more details about it, ma'am?
Yeah. So, looking inward, a toolkit is basically has been designed for the Rotarians because we call ourselves people of action, we call ourselves people of service, and we strongly believe that if your basket is empty, you cannot offer something to others.
Mm,
So similarly, if you are healthy, then only you will be able to work in the society.
yes.
And when we are talking of being healthy, it is not a physical health because even WHO includes mental health, physical health, and even social health for that matter in the definition.
Yes.
So when we are talking about mental health, President Gordon thought of, within the club, what happens? We meet for weekly meetings.
Mhm.
Those are known as fellowship meetings. So we invite speakers, they come and they talk about, say, half an hour to 40 minutes. And then there is 20 to 25 minutes of time where we talk to each other. Like
Mm,
the club members, they talk to each other. So that is why he came up with the idea that we should talk to us. How are how am I feeling?
mm,
And then I should be talking to asking you, how are you really? Usually it is like mechanically we ask, how are you? And then you will answer, I'm okay, I'm good. But
mhm.
then that is not actually, that will not tell me about, your mental state currently. So
Yes.
if you're worried, if you're stressed, then you should be able to, not necessarily talk to me, but some other member. And with that, we want to inculcate empathy building within the members, then we can go out in the society and help other people. So
Yes.
that was the basic. And of course, what he did, it is a Google form questionnaire of 1 minute. So we have to solve few questions. So he do data from that, and he's going to compare after a certain periods. Like it was done in the beginning of the year, then it was done in the middle of the year. Then again, he will do the similar survey by end of the year, next Rotary year, and then he will come to know our awareness of mental health and how we are treating each other, and then how are we going to face the society when it comes to mental health awareness.
Okay. Ma'am, I just summarize what I understand because this is very interesting. Because many people who are into service field, see, they don't take care of themselves, and in the process, they get burnout at a point because there is no recharge for them. So it's a very nice project where you are trying to recharge your Rotarians and trying to make them full.
Yes, correct.
Yes. So you have any specific activities you do for them, or this is like, you maybe make them aware of the issues? What
There
do
are different activities. Like as I told you about the weekly meetings or the fellowship meetings. So we have a talk in those meetings.
you?
Then, if at all we feel that a person is having some problem, then we try to talk to them on a one-on-one basis. So there is awareness session, then there is personal talks, and then also during the normal conversations we try to inform them about various mental health issues.
Mm,
So that happens at the club level, but we can visit other clubs. Like, for example, my club name is Rotary Club of Nasik Grape City. I
mm,
stay in Nasik, Maharashtra. But
yes,
then I can visit other clubs of Nasik and I can talk to them about mental health. So
actually.
that is how we try to break the stigma and increase awareness.
So like this, you are taking up different, projects or activities under RAG.
Yes. Yes.
So I heard in your, intro, I saw there is a, magazine named Mind Matters. So can we
Yes.
understand more about it? Because it's a very good initiative again.
Yes, yes, yes. So, before I talk about Mind Matters, I would like to inform you about the district chapters.
Mm.
I told you about the Rotary Club. So, certain clubs in a geographical area, they are known as a district. Okay, and they differ from the revenue districts. So some part of Maharashtra, including 100 clubs, forms a district 3030.
Ah,
So one psychologist Rita Agarwal. She's from Nagpur, again Maharashtra, which is a part of 3030. She is a founder director of Ragni. And during the work, she realized that when we talk about the global picture, the scenario is different. But when we talk about the local problems, the need is different. That is why she thought of, having the same format in the district. So
Mhm.
that is why we call ourselves DAGMI, that is the District Action Group on Mental Health Initiatives, or we call ourselves as District Chapter of RAGMI. So since we belong to the District 3030, we become the District Chapter or DAGMI 3030. So now when we are talking about different activities and different projects, again, Rita Agarwal, she is a very eminent writer and columnist. There is a local newspaper, Hitwad, and she has been writing weekly articles in that paper since last 35 years, more than that.
Oh.
So she came up with the idea of having this Mind Matter magazine. So what we do is we take up a theme. Say, for example, we talk about stress. Then we select subtopics like what is stress. Then there is something known as positive stress. Then what is negative stress? How to tackle the stressful situations. So
Hmm.
then we invite writers to write on these subtopics, and we try to keep the articles crisp, but at the same time in a simple language which a layperson can easily understand. Also, we publish the projects done in different Rotary clubs in that magazine. Usually, on the first page, we invite sponsorships, and against those sponsorship, we conduct interviews of the Rotary club presidents. That is the first member of the club, and the Rotary projects reports. Those are published on first page, and other details are published on the rest of the pages. It is the e-magazine, so it
Mhm.
is distributed all over India and of course across the globe.
Oh, it's an e-magazine, so you can send it across.
Yes, yes, yes. And there are various schools and colleges. So we send the magazine to the principals or the student in charge faculty, and in turn they distribute the magazine to their students and staff.
Yes, yes. So
So through social
you
media,
choose topics for each month.
yes, yes,
Is it a
yes,
monthly magazine, ma?
yes. It is a monthly magazine. It is a
Oh,
monthly magazine.
okay. So anybody can subscribe for that?
Yes, yes. They can. They can.
Very good. So I think we will be doing it shortly
Yes.
so
So
that we get.
maybe once our interview is over, I will share all the necessary links with you, so that you can share with whoever is interested in getting that magazine. So there is an email, if email ID. If someone sends and request for the subscription, we start sending the magazine. Up till now, we have done almost 40 magazines, 40 different issues
Oh,
in last
40.
3 years. Yes.
Right, right, right. Very good, ma'am. Is there any way we can get the copies of 40 for the only counselors group?
Yes, soft. I will send you all the soft copies.
Right, right. So that because this is mostly our, audience are mostly into mental health field,
Hmm.
counselors and teachers and educators. So they get benefit and also they can distribute to others.
Yes.
If,
Also, there are few issues amongst these 40 that talk about what Rotary is doing.
Acha.
Okay, because as in the beginning, I told you about the Rotaracts and Interact clubs. So it is something like a Rotary club, but within the school and the colleges.
Okay.
Okay, so the Rotaract Club is for the youngsters from the age group between 18 to 30. So even they are doing good work in the field of mental health. For example, some of them have started, peer support groups.
Mhm.
Then some of them have started circle groups. So in these, they meet periodically
Mhm.
and they discuss their issues. They may not necessarily be serious mental health issues or illnesses, but even small stressful situations, or there is exam, someone is feeling anxious about maybe the exam or the results. So they discuss amongst themselves in these groups.
So, Abaji, can we have again, can we, understand what are the different activities or how you are spreading this across the nation? What are you actually doing to, from this RAGMI? You have a lot of initiatives, right? So, what are the ways and means of spreading this RAGMI, across the nation?
Okay, so as I told you about DAGMI 3030, we started during COVID.
Hmm.
And what we did was we conducted online sessions, maybe a 30-minute small session or a 2-hour session or a longer session. And then we had our own website. We started with this Mind Matter magazine. And slowly and gradually, people across the globe, they felt that whatever the district chapter is doing is a good work and we should all replicate that. So different districts, different Rotary districts, they had their own district chapters. So there are 30 plus chapters across the globe and more than 10 chapters in India. So what we do, we conduct each chapter conduct different projects. For example, we talk about US. They have something known as a lever, which is for the school children with the
Hmm.
help of Boston Pediatric Hospital. So
Okay.
they are conducting that program for awareness of mental health awareness and well-being of school children. Then there is one action group in Pune. They are working for geriatric mental health, that is elderly mental health.
Mhm.
Apart from that, what we do is we do some combined projects. We come together, we join hands. So the India chapters together, we call ourselves as DAGMI India. So recently, in the month of August, we had conducted one online program which was, which covered almost 45 Rotary districts. It was celebrating mental health, and we focused youth mental health in that program. And
Acha.
again, we are planning one more program on the coming 12th of August, which is a International Youth Day. So
Oh,
we are joining hands together and we are focusing on youth mental health. So individually, single club or clubs together, that is on a district level, or the districts coming together, that is on the India level. That is how we are trying to do the programs and spread the awareness.
right. Ma'am, if anybody want to join Rotary, or once they become Rotarian, then they will be like into this RAGMI, if I'm right. Or someone else also can join this RAGMI directly.
Of course, I will put emphasis that a person should join Rotary Club, okay?
Mm-hmm. Mm-hmm.
Because there are other actions or other services which they can become a part of. But however, if they want to, focus only on one particular subject and they want to join the action group, then non-Rotarians also can join the action groups.
So,
Okay.
so okay. Tell me, ma'am, tell me.
Yeah. However, when it comes to the leadership position, unless and until you are a Rotarian or Rotractor, you cannot come on the leadership position. So, for two reasons, you should join Rotary, of course, to serve the people, do certain projects, do some social service. There are different avenues where you can work on. So that is why you should join Rotary. And again, if you want to become a president or a secretary or a chapter chair, then it is better that you are a Rotarian. But if you want to work in the field and you are a non-Rotarian, you are most welcome.
Right, because sometimes there are so many limitations for people. So, but still they are interested, or a counselor, a psychologist, or someone who want to be, as a member of that team. That is beneficial for both of us.
Yes.
Like the member and also as a RAGMI, you also
Yes.
benefited.
See what happens. Even I am a professional, so we have to give equal attention to our profession also. So then you have to decide where you want to spend your time. So you can become a RAGMI member or a DAGMI member, or you can join a Rotary club, and through that again you can become a RAGMI member. Both is okay.
Right, got it, ma'am. Got it. So it was wonderful to understand about the Rotary clubs and action groups and RAGMI, DAGMI. So many things we come to know because knowledge is everything. So today we understood a lot from you, so that this knowledge can be again transmitted to someone whom we interact with in our day-to-day lives. That was so nice, ma'am. So what is your, this is the last question, then we'll take questions from others. So what do you inform, or what is that message you want to give in one or two sentences to the viewers, about mental health?
We talk a lot about breaking the stigma. Now, stigma is like in Hindi, they say सबसे बड़ा रोग क्या कहेंगे लोग. So people usually are anxious, when it comes to sharing their problems, or even if there are not major problems, they kind of हिचकिचाते हैं when it comes to sharing the problems. So that is why, as one of our toolkits says, don't bottle it up. Try to, share your thoughts. There is a wonderful project a girl from Bangladesh has started, and we are trying to replicate it in the coming Rotary year. It is known as Moner Boksho in Bangla.
Mhm.
So you can say a mind box.
Mhm.
Literal translation is mind box, but it is like later from the mind to the mind. So you can write unanimous letters and put it in that letter box. And the mental health experts from the institute, she had done it in her college. So the experts, the psychologists from the college, once in a day she would open up that box, go through the letters, and just address the issues all together, so that no one is pinpointed. Okay, like Abha has got this problem or Geeta has got this problem. Without announcing our names, our problems will be addressed and, you know, trying to give a solution. So
Mhm.
please open up and please talk about mental health. And if someone is going through some problem, don't mock that person, don't judge that person. That's all.
Thank you so much. It was really interesting message and interesting, statement. The final, statement what you gave, because very important. Stigma is still there. It is, actually happening. Some awareness and insight is developing in the society, but still that, stigma is still prevailing in some societies. Right. So we'll wait for 2 minutes to take the questions. We have around 7 minutes of time. So if you have any questions, we welcome you. Later, who are watching this live, you can post your questions in the box, the live chat box. So we will answer there also. But now, right now, who are watching, any questions? Very quick questions. Amri? Or, we have Dr. Sridevi, Madhurima, Nibha. So, and others, many people are there. Like, किसी को क्वेश्चन पूछना है, we hardly have 5 minutes time. One or two questions we'll take if at all you have questions. Right. Good. Thank you. Good to go. So we'll wait for your links, ma'am. I want you to send the, across the info so that I can, give it to all the group members, and also give the, information to mental health professionals also in the field. Right.
Yes.
So thank you so much for joining us.
Thank
And
you for having
we
me.
look forward to work with this RAGME across nation. And also we want to, give us our small part of support to RAGMIS wherever it is possible, because as Manojagriti, we are a group of mental health professionals. We have around 300 psychologists with us. So, if we are helpful for you in any way, please, get back to us, and we are ready to serve the society and Rotary also. Thank you.
Definitely.
Namaste, and thank you all for
Thank you.
joining us. We'll see you with the next Sai interview coming Friday. Thank you, ma'am. Bye.
Bye. Okay.